So you have been prescribed opioids to help manage your chronic pain, or have been given opioids for over 2 weeks. You may have also been on opioids for months or even years. Whatever your situation is, we'd like to review some of the new requirements and tips on how to keep you and your family safe. Opioids are powerful painkillers, and they're very good at helping people reduce their pain. But there are risks to taking opioids, and these risks become greater when taking opioids long-term. Medicine is constantly changing, and as we learn more about how our bodies react to certain medications, recommendations change. We now understand the risk of taking opioids more than we ever have in the past. Based on both state and federal laws and guidelines, there may be a few things asked of you when taking opioids long-term. Please understand these items are about safety and are not meant to punish or limit your pain control.
First, we'll start with some of the new requirements, including the Opioid Agreement, which is like signing a consent for a surgery. This agreement reviews some of the risks of taking long-term opioids and your responsibilities while taking opioids. Some of the risks include addiction, which is when your body begins to crave and need the medication, overdose, decreased breathing, and pain caused by opioids. When opioids cause pain, the term is opioid-induced hyperalgesia. People that experience this will have pain that does not get better when they take their opioid, even when the dose is increased. They may also experience pain in more areas of the body or with normally non-painful activities like getting dressed or even being touched. When signing your opioid agreement, you and your provider should discuss the goal of the opioid therapy. When dealing with chronic pain, many times, trying to achieve zero pain is not possible. Instead, think of activities that pain limits you from doing and set those activities as goals. If opioid medications are not helping you achieve those goals, your provider may choose to wean you off your opioid medication or try different medications or therapies to help you reach your goals.
Second, screening. As part of the standard of care throughout the country, everyone prescribed an opioid will now be asked to perform urine drug screens. This is an important way to continue to have transparency with your provider and keep you safe. This is a simple test like collecting urine to test for infection or pregnancy. In addition to urine drug screening, you may also be asked a series of questions that help us know how your body may react to opioid pain medication. Additionally, your provider may ask that you bring your prescription bottle each time you come to your appointment, and they may perform a pill count to determine the number of pills you have left in your prescription.
Your clinician may also give you a prescription for Naloxone or Narcan. This is a medication that can reverse opioid overdose. It's become a standard around the country that if you have certain medical conditions or take certain types of medications, that your provider prescribes Naloxone. This medication is life-saving and works quickly, much quicker than waiting for an ambulance. We encourage you to fill this medication. Many insurances cover this 100%. You only need to fill it once per year. And you can even use Naloxone if your pet accidentally takes your medication. If you have questions about Naloxone or did not receive this prescription and would like one, please talk to your provider. Naloxone saves lives.
It's important to understand that your provider may decide that the risks to opioids outweigh the benefit, or if you do not comply with the opioid agreement, there will be adjustments made by the clinician. Examples of non-compliance include refusing urine drug tests, having medications in urine that were not prescribed to you, or going to more than one provider. When this happens, your provider will discuss this with you, as well as options for your pain control. You will be weaned off the medication to avoid withdrawal symptoms. Withdrawal happens when our bodies become used to the medication. Symptoms of withdrawal can include increased pain, vomiting, diarrhea, agitation, goose pimple skin, and shaking. While withdrawal from opioids in most cases is not life-threatening, it is uncomfortable, and we would like to keep these symptoms limited.
Number 1, always take your medication as prescribed. Never take more than the bottle says to take. If you're having more pain, it is important to call the clinician that prescribed the medication or your primary care doctor. Sometimes needing more pain medication than prescribed could mean that something else is going on. Also, only take the medication for the reason it was prescribed. For example, if you have chronic low back pain, but were prescribed opioid pain medication for a different injury or surgery, you should not take the medication to treat your low back pain. Taking more than prescribed, taking them for other pain reasons, to sleep, or to feel high are all considered forms of opioid misuse.
Number 2, always keep your opioid pain medication in a safe location, either high in a medicine cabinet or even in a lockbox. This is especially important if you have children that come into the house. The number of accidental opioid poisonings has risen sharply over the last 10 years, so it's extremely important to take this simple safety measure.
Number 3, never share your medications with anyone, including family members. Opioid pain medication interacts with many of the other types of medications, and with certain medical conditions can be deadly. The dosage and type of the pain medication that your clinician prescribed was based on you individually. Your weight, age, health conditions, other medications, all of these were considered when the clinician prescribed the pain medication.
Number 4, do not drink alcohol while taking opioid pain medication. Combining alcohol with opioid pain medication can lead to death. Always tell your provider all the medications you are taking, including prescription medications like benzodiazepines, such as Xanax, Valium, or other tranquilizers, as well as over-the-counter medications like Benadryl. These medications can interact with opioids. And do not operate heavy machinery, including driving a car, while taking opioids.
Number 5, after a few days, if you have not taken any of the pain medication, it's important that you dispose of the leftover medication. We now know that unused pain medication often falls into the wrong hands. A recent study showed that most teenagers that experiment with opioids get them from their parents' medicine cabinet. So, if you are not using your pain medication, it is safest to get rid of it. You can find a drop-off location on the Drug Enforcement Administration's website or many police stations. Many retail pharmacies will now take your unused medications too. And there are drug disposal systems on the market that may be available to you, such as RX Destroyer or Deterra. If you cannot go somewhere to get rid of your opioids, or you do not have a personal drug disposal system like the one mentioned, then the next best thing is to take the opioids out of the bottle, put them with something unpleasant like coffee grounds, and toss in the regular garbage. Then black out the information on the bottle and toss that in the garbage too. This will help prevent anyone from finding and taking the unused opioids, even after you've thrown them out.
You've just heard some of the new state and federal requirements and 5 simple tips to keep you and your loved ones safe while taking your prescription opioids. Always keep in mind that opioid pain medications are meant to lower your pain, but not always take it away completely. Pain is common for many people, and it is a way for our bodies to tell us that something is wrong and to slow down. Listen to your body and talk to your provider. There may be things you can do in addition to or instead of opioids to manage your chronic pain. If you feel at any time that you may have become addicted to your pain medication, your body is craving the medication, you're taking more than prescribed, or it's negatively affecting your relationships or your job, please talk to your clinician. There are ways to treat opioid addiction, and addiction can be a complication from taking opioids, even as prescribed for some patients. You can also call the Substance Abuse and Mental Health Services Administration National Helpline. That is 1-800-662-HELP, 24 hours a day, 7 days per week. Thank you for taking the time to learn about opioid medications for chronic or extended use. At Advocate Aurora Health, we are here to keep you safe and help you live well.